Dear colleagues, we have already spoken in the previous presentation that many doctors and even scientists do not distinguish dizziness against vertigo. But why it is important? First of all, because of legislation. WHO, World Health Organization, has one of the most important documents, International Classification of Diseases. And in this document, dizziness is R42 and vertigo is H81. The patient description means dizziness is disturbance of perception of space, movement and time. The patient tells that when he is driving home, he must make a left turn and cross the line of the traffic moving in the opposite direction. 1 month ago it was easy going, but now he is standing and waiting till at last all the traffic will pass and he cannot find the moment, catch the minute when to turn. Vertigo. It is the illusion of non-existent movement, mostly rotatory, but might be in other versions. Usually, vertigo means acute pathology and is accompanied with disequilibria, retching, vomiting, and even consciousness loss. In order to analyze the necessity of this differentiation, we have studied enough material, 154 persons with vertigo dizziness attacks, and vestibular dysfunction has been documented instrumentally with the vestibular evoked potential. And we have seen that cooling or heating the external ear with the help of water, 44 and 30 degrees, caused in some patients dizziness, in some patients vertigo. And it has happened that the frequency of vertigo appeared to be statistically significant higher than for dizziness. Why it has happened so? We know that there are two types of the receptor cells in the vestibular peripheral organ. One is big and the other one is small cell. Big cells are concentrated in the center of the receptor and is related to the thick fibers, while small cells are distributed at the whole receptor and is connected with thin fibers. So, thick fibers terminate in only one zone, central magnocellular portion of the superior vestibular nucleus, while the thin fibers are dispersed in the vestibular nuclear complex. Then, There are several pathways from vestibular receptor to the cortex, and the shortest one has the latency of 3-5 milliseconds. This means that it is very straight, direct pathway. So we can speak that there are two systems in the vestibular cortical projection which are responsible for two types of sensation. So what is also very interesting that in the most patients vertigo sensation is formed in the right hemisphere, while dizziness in the left one. In physiological conditions, we meet vertigo at the different types of the entertainments like carrossery, rotation, and dizziness in hyperventilation. In pathological conditions, vertigo is typical for cupulolithiasis, vestibular neuronitis, Meniere's disease, and dizziness is typical for chronic diseases. Then, if you will see this table, you see that dizziness is affected by nootrops, and vertigo is not affected so strongly by nootrops. So, in dizziness, we need nootropic medication. From the other side, vestibular blockers are more effective on vertigo and much less on dizziness. So, vertigo needs medication with sedative activity. But what is very important, vertigo in many cases may transform into dizziness after 2-3 weeks of treatment, and that means that we have to be very attentive at this moment. How can simple doctor or even patient differentiate vertigo from dizziness without any complicated devices? Critical question. Can the patient identify the speed and direction of movement? If patient says from the left to the right, slowly or quickly, it's vertigo. If he is scared and cannot answer this question, it is dizziness. In order to know more information about this, you are welcome to visit our site Happy Vertigo, and you are welcome to International Dizziness Academy to study more details about this information.